Hello, everyone. Thank you for joining me today. Today, I will be discussing with you a serious problem that occurs in the healthcare world. I will talk about why it is a problem, solutions for the problem, providing pros and cons to each solution, and a recommendation to help fix the problem. What I will be reviewing with you is something that is called alarm fatigue. According to the National Association of Clinical Nurse Specialists, alarm fatigue occurs when clinicians become desensitized and non reactive to the sensory overload created by an overwhelming number of alarms. Many of these alarms are a nuisance or non actionable alarm. Delayed responses and silenced alarms constitute significant threats to patient safety. Alarm fatigue has been implicated as the lead contributing factor in centennial events related to alarm safety. 85 to 99% of alarms that occur do not require clinical intervention. Also, in each hour, it has been estimated that 190 alarms will sound. This is an astronomical number that could easily create fatigue for the staff and for the patients. Let's discuss why these alarms may sound. Peggy Enslin, a nurse, states that contributing factors to alarm fatigue include the following. Alarm parameter thresholds may be set too tight. Alarm settings are not adjusted to the individual patient. Poor signals, the inability of staff to hear alarms or detect where an alarm is coming from, and inadequate staff training on monitors and alarms, inadequate staff response to alarms, and malfunctioning of the alarms. The Joint Commission points out 4 strategies to help solve this problem. The first solution is to develop a multidisciplinary team to review trends and develop protocols. A multidisciplinary team would include physicians, nurses, respiratory, the individuals that are cleaning the hospital. This is what a multidisciplinary team is. So there's a lot of individuals involved here. A pro to this would be that there's multiple people taking part, so there's a lot of great expertise. Also, that you'd be getting input from the staff. And lastly, that it's a standard that's universal. Cons to this solution would be that the set standard may not function for all patients. Each discipline may have a different purpose for the alarm. The second solution is to reduce the number of false positive alarms. Pros to this would be that there'd be a reduction in alarms. Patients will be more comfortable and less concerned with numerous alarms sounding around them. And also, there's a better chance that when an alarm does sound, that it is important to respond. Cons to this would be that it's not very feasible. How do we determine what is relevant and what is not? You could possibly miss an important situation. The third solution is to review and adjust default parameter settings and ensure appropriate settings for different clinical areas. So whether you're on a generic oncology floor or whether you're not on an intensive care unit, you want to make sure that there's appropriate settings for each unit. Pros to this would be that there would be a standard, and this standard would be unit specific, and there would be a protocol to follow. Cons to this would be that it's not patient specific because it is a default, and floating staff will have no standard to go by. Floating staff is staff that will go to all different floors in the hospital. They'll go between intensive care units or oncology units, and this would be really hard for the floating staff to be able to memorize and retain all of the protocols that are specific to each unit. The fourth solution is to create procedures that allow staff to customize alarms based on the individual patient's condition. pros to this would be that it is geared toward the patient's condition. It gives staff the ability to use personal skills that they have learned in school and also clinically. And also, there would be a decrease in the number of alarms. Cons to this would be that everyone has their own standard. Each nurse has their own way of doing things, so there would be no standard involved here. And there could also be a change in patient status. So if you have this default setting that is set and a patient's status changes, these alarms would no longer be effective and efficient for this patient. So what my recommendation would be to do is to educate and to train the staff appropriately and frequently. This is the best solution because with proper training, less mistakes can occur and patient safety is at an all-time high. Follow the famous saying, who, what, when, where, why. Who? Who has the authority to set, change, and disable alarm signals? What? What is a clinically appropriate setting for the alarm signals? When? When can alarm signals be disabled or changed? And also, when checking the alarms, look for accurate settings, proper operations, and detectability. Where? Where are you monitoring and responding to these alarms? And lastly, why? Why are the alarms set the way that they are? These steps are so important and can be learned through proper education and frequent education. So now that you have heard all about alarm fatigue, I hope that everyone realizes that this is a serious problem, but with this problem comes multiple solutions. Just remember, who, what, when, where, why. Thank you everybody for taking the time today to listen to me, and I hope that you have a great day.